Well, as more and more businesses reopen, even with those restrictions in place, what are medical experts expecting to see when it comes to COVID-19? Joining us with some insight, Singing River Health System's Chief Medical Officer, Dr. Randy Roth. Dr. Roth, thanks so much for joining us today.
You're welcome. Thanks for having me.
Yeah, tell me a little bit about your concerns as more and more businesses are opening up and people are getting out more. Casinos opening today. That's a huge step. What are your thoughts and concerns as we move into this new phase?
My biggest concern is the vulnerable people need not to go to these places. If you're 68 years old and you're on dialysis and you take 15 medications, you probably shouldn't go to the casinos and do that. I think that's going to expose these folks to a lot of risk. That's my biggest concern. My second concern is, are people going to let their guard down with hand hygiene and social distancing? Just because our numbers are decreasing in the hospital doesn't mean this virus is no longer present in our community.
Yeah, unfortunately, I think we're already seeing that. At least I'm seeing that a lot. Fewer people wearing masks, and I think people are taking fewer precautions already because they're starting to feel more comfortable with the situation. Are you seeing that too?
Yes, ma'am, we're seeing that. And I've reminded several people in the hospital. They used to see people washing their hands every 15 seconds, and now it's gotten to be every couple minutes. And got to remind people that this virus is still in our community.
Yeah, I know just today, during the governor's press conference, the state health officer, Dr. Dobbs, said 87 patients are on ventilators in Mississippi, and that's more than we've ever had on ventilators. Although it's not a big increase or anything, it's still a sign that we have to continue to be vigilant, and the case numbers continue to grow.
Sure, we're down to 3 in the ventilator and 5 in the hospital today. Much less than we had in late March and early April, but we still have cases. We had a case yesterday. This is not just going to go away when the summer gets here. I think the cases will decrease as we do a better job with social distancing and continue to be upfront about not letting your guard down. And again, I want to reiterate, a lot of this is going to be selection of people in our community, knowing who is high risk and trying to keep them away from the vectors that are still out there.
Right, and that is so important. People don't have to go out just because they can, in other words.
Yes, ma'am, absolutely.
And you mentioned as the numbers decrease in the summer, through the summer, hopefully, what are you concerned about in terms of the resurgence that we're hearing about that may occur in the fall-winter months? What do you think might happen there, and are you expecting this to happen again as well?
We're planning that there'll be a surge in the summer, early fall. Hopefully it will not mirror what we went through in March and April. The heat of the summer will help keep that down. A lot of it's going to do with how we resurge in our business world and make sure our highly vulnerable people are continually reminded to take care of themselves. Continue social distancing, hand hygiene, and if you have these risk factors, consider whether you need to be in church or the casino or on a cruise ship.
Right, and it seems like that's something you keep going back to and wanting to push. And I think it's important because as people start realizing they can go out and they're seeing their families again, maybe people they haven't spent time with, they may be putting off the social distancing, not wearing masks around some of these vulnerable people. And people need to continue to protect themselves, particularly those 65 and older and with other certain health conditions that put them at higher risk.
I agree.
Okay, well, hopefully things will continue to improve, and it's good to see you as always. Thanks so much for joining us, Dr. Roth.
Thank you.